So your doctor told you that you have fatty liver or fatty liver disease and did not explain much about it, and now you're worried if this is something dangerous. Today, I will help you understand this condition better so you can make better decisions to improve your health. Hello, my name is Dr. Vikram Gupta and I'm a practicing board-certified family doctor in New Jersey. I see these conditions in my office every day. During the office hours, a lot of doctors don't have time to explain these conditions in detail or in simple language. And I think that the more the patient understands in simple language, the better control over their own health they have. Sharing this with you helps me understand this condition better myself and helps you understand this in plain, simple language. Before we talk about the fatty liver, what is the liver? So the liver is a very essential organ that's found on the right side of the belly, and if I had to compare this is like the kitchen of the house. Its main job is to filter the blood coming from the digestive tract. Its job is to also process the medications that we take, any alcohol that we drink, and it helps in detoxification of the body. It also makes proteins that are necessary for clotting of the blood and many other functions. It also makes bile that is necessary for digestion of food. So what is fatty liver? Fatty liver is basically that if it contains too much fat. There is some fat in the liver, but if it's more than 5 or 10%, then it's called fatty liver. So you wonder if this is a problem. Most commonly it's caused by excessive weight, high cholesterol, and especially diabetes. Doctors also call it with other names depending on what stage it's at. It can be fatty liver, it can be NAFLD or MAFLD or NASH, NASH, which can further progress into cirrhosis or liver failure and HCC, hepatocellular carcinoma. Not important. The point is we're talking about the beginning stages and what we do about that so that it doesn't get into where it's a problem. So now you ask, so what symptoms do I have? How do I know if I have fatty liver? Well, there's good news and bad news. The good news is that it has no symptoms. You will not know. It's mostly an incidental finding. You had blood work done and your doctor noted that your liver enzymes are slightly high, then he might have sent you for an ultrasound and then it came back as fatty liver. Or you went for some other reason, like you had a CAT scan or another ultrasound for another reason, and over there they also made an incidental finding of fatty liver. So if it's mostly an incidental finding, it has no symptoms, then why does it matter? Because it can progress into liver disease, which is inflammation of the liver. It can progress into cirrhosis, liver failure, and even cancer of the liver. Now the good news is that in most people it will not progress into liver disease or liver failure or even cancer, but the bad news is that we don't know in whose case it might actually do that. We know that people with diabetes, excessive weight, and high cholesterol are more at risk where it's going to progress into liver disease. And since a lot of people have these conditions in the United States, it becomes more important to pay more attention to this condition. And another thing is that, like, if you have diabetes and you have high cholesterol and now you're drinking on top of that, but you're trying to stay within the moderate recommended range of 1 to 2 drinks a day, that may not be appropriate for you, because you might be taking medications for the cholesterol, you might be taking medications for diabetes, you might be taking medications for your heart, and now you decide to have 1 or 2 drinks a day, which for you that may not be appropriate. So we may need to still continue to make some changes to prevent the progression of this condition. And if it starts progressing, then it can be dangerous. Okay, so how do we know it's progressing? Well, based on the blood tests that were already done, there are some formulas that can help us evaluate if you're in the first, second, or the third stage of the progression of the fatty liver disease, and that can help us decide who we need to monitor more closely or do further testing to assess the liver stiffness. So if I had to simplify this, we check the blood work, we check what stage it is in. You don't need to do any other testing. It's basically found in the blood work that's already done. So we just have to calculate if it's in the first, second, or the third stage. And I'm just saying, keeping it simple, first, second, or third stage. So in the second stage, we need to check the liver stiffness so that we can know how strict we need to be with the management. And if it's already in the third stage, then you should be followed by specialists. You might even need a liver biopsy. But that's, again, these things can be discussed with the doctor. The key point is to know where we are. So treatment-wise, There is no particular treatment for this. It's basically prevention and being aware of this problem. So there are certain foods that you can avoid, and there are certain things that you can do that will help you. What to avoid? Alcohol, fried, fatty, and sweet foods, junk foods, sodas, juices. So what can you eat then? Grains, cereals. Mediterranean diet is a good diet for reversal or slowing down the progression of. You can Google Mediterranean diet and you'll get a reasonable amount of information on the internet. Use olive oil for cooking, that's healthier. Some studies have shown that coffee might be beneficial. Some studies have shown that vitamin E in certain quantities might be helpful. But most important, what is shown is weight loss. Now there are some medications, and a new study came out saying bariatric surgery is also helpful in reversing fatty liver disease, but I think they're all related to weight loss. People lose weight with bariatric surgery, and some of the medications for diabetes that have slowed down the progression of fatty liver disease or even reversal, they are also associated with weight loss. So I'm assuming that this is more to do with weight loss than the medications itself. So overall, is it dangerous for you? It's dangerous if it starts progressing into liver disease. So it's more like, how do you monitor it and how do you be aware? Like, you should be asking your doctor, what's my fibrosis score? And should I go for further testing to check the liver stiffness? Not everybody needs to go for the liver stiffness test, but you should be asking your doctor. And I want my patients to be more involved in their own care, understanding what this is and how you can do more to help yourself. Let me know if you have other questions or any other conditions that you want me to talk about. I'll be happy to do so. Thank you very much. My name is Dr. Vikram Gupta. See you soon.